Well, good afternoon, everyone, and welcome to Trust for America's Health AIDS-Friendly Public Health Systems first training of 2026. Happy New Year to you all. I feel like, when we get to this time of year, and we've reflected on 2025 and thinking about 2026 and a whole new year. And I was just thinking of how grateful I am to be here, to be another year older. I turned 68 last month, actually, and just so happy to have life ahead of me and to have this work in front of us, which is so crucial, so important, and so personal to many of us. So we're really happy that you are here today, and hope that you are as excited as we are to begin a new year of collaboration and supporting older adult health and well-being. And we look forward to working with many of you. So my name is Megan Wolf, and I'm joined today by my colleague, Dr. Karan Phillips, and our new intern, our policy development intern, Caitlin. Thanks for joining us, Caitlin. And our AFPHS, or Age-Friendly Public Health Systems movement, would not be possible without the generous support from and partnership with the John A. Hartford Foundation. Next slide, please. So let's please keep our devices muted during the presentation today so we can avoid any potential background noise, but please do feel free to put your questions in the chat throughout our presentation. And I think there will be some opportunities for some interactivity as well from our presenter, and we'll try and have a little bit of time at the end as well for some discussion or questions and answers. Next slide, please. All of our AFPHS trainings are recorded, and the slide deck and link to the recording will be shared with anyone who has registered for the training afterwards. We ask that if you're using an AI note-taking tool, that please let us know by commenting in the chat before our speaker begins. And in addition, you must be present in the training with the AI note-taking tool. Notes generated from any AI tool can only be used for personal use. Next slide. Also, your feedback is very valuable to us, so we'd appreciate it if you would take a few moments after the session today to complete the anonymous feedback survey that will pop up on your screen at the end of the training. Your insights will be shared with our evaluators and will greatly assist us in enhancing future trainings. Next slide. As most of you know, Trust for America's Health, or TFAH, is a public health policy research and advocacy organization dedicated to optimal health and well-being for every person and community. We're well known for our in-depth reports, and our most recent report published last month is Advancing Policies That Create Conditions for Good Health, which is the latest in our series on promoting health and cost control in states. And we have a webinar on this report that is scheduled for January 21 at 2 p.m. Eastern. So you can register for that webinar on the TFAH website under webinars and briefings. We also publish briefs related to our AFPHS work, and our most recent report is on the public health sector's roles in supporting family caregivers, and you can access that brief on the AFPHS website. Next slide, please. So as in the last few years, we believe starting out the year with a refresher on ageism is a great way to position all that we do. And we're really happy to have our colleague here today, Hannah Albers, who's the Director of Program Development for the National Center to Reframe Aging. We're really happy to have Hannah here today, and I always learn so much whenever I hear Hannah speak at a conference or a webinar. So Hannah, we're so happy to have you, and I'm going to turn over the presentation to you at this point. Thank you so much.
Well, Megan, I echo your thanks, and I'm glad that you all include this as part of the beginning of the year for this education series. I too learn every time we get to spend time together, so I'm glad to be joining with you all and bring greetings from the rest of the team. As Megan mentioned, we're going to start off with a question, an opportunity to engage in the chat. So I want you to type yay or use the party emoji if your answer to this question is yes. Are you part of the aging population? Open my chat here so I can see what people are sharing. I see Megan, your thumbs up. Thank you, Cheryl, for kicking us off. All right, some more party emojis. There you go. Sometimes it takes a little bit of time to find that reaction button. I'll let the yeses keep pouring in because this is a little bit of a unfair question to ask, but all of us should be saying yes. And just like Megan demonstrated for us at the beginning, celebrating the fact that we are getting older. So a happy belated birthday to you, Megan, and thanks for owning and celebrating your age there. Um, but we start with this because for a lot of us, and I know for me, my instinctual response to this type of question would have been kind of like I don't think that's me. I don't think that's me yet. Um, and that's because of what we're taught in everyday messages about what it means to be older, about what we should think about older people, about aging. So I just invite you for a moment. You can look at the screen for some prompts, but think of what marketing you see on a day-to-day basis that tells you to get rid of the wrinkles or dye your gray hairs, maintain your youthful appearance, the serums, the pillowcases, the XYZ items that are all marketed as anti-aging products. Um, or think about the birthday card. So, what birthday card might you have access to buy Megan in celebrating her birthday in comparison to the milestone birthday card I could buy for my 5-year-old niece, right? And what those birthday cards, the different messages that they're telling people about how they should feel about this milestone that they've achieved. Um, it's the way that news portrays older people and how our research and how other programs and policy and other things like that are reported in the news. Um, it's the jokes we tell, the seemingly kind of harmless, ageist jokes that we might tell or we might hear on late night television shows or that latest sitcom that was released. And it starts from a very early age, even thinking about the types of stories that were told as children or that we might tell our children in our life, and how that portrays older people. Maybe that grouchy kind of witch figure in a lot of our stories. So when we think about this kind of as minor incidents, it doesn't feel all that egregious. But when you pull it together as a compilation, it really provides a profound kind of overarching image of, again, what we're taught to think about older people and what we're taught to think about aging. And so, our goal in this work to understand ageism and to understand reframing aging is to tell that more complete and accurate story of aging. The really highlighting the diversity that we become more and more diverse as we get older. And we want people to understand that, embrace that, and not fear or battle that. So as we get started, and Megan, thank you for introducing me and welcoming to me to this work. I wanted to share a story with you all, what I refer to as my reframing aging aha moment. So before I was ever working with the National Center to Reframe Aging, which is work I started formally in 2022, but have been engaged in this work since 2020. So years before I even knew that this was a concept. I was 22 years old and I found myself living in a retirement community for a year, which is a story for another time. But the important part is that I got to know my next door neighbor, Miss Shirley, who was in her 90s, and through Miss Shirley, I got to know her daughter, who one weekend I asked Miss Shirley's daughter, "What are you up to?" And she responded, "Well, I'm turning 70 this weekend, so we're having a big party." And it's a very vivid memory for me, and I look back on it because I remember thinking, oh my goodness, one day I could be living in this type of community with my mom. And I had never thought about the fact that this aging population that I had the opportunity to call my neighbor represented generations of people. And it helped me realize that I'd been thinking about this group of people, um, and not really appreciating the diversity that they represented. Um, and I share this because for me, living in a retirement community at the age of 2020, or at the age of 22, having this realization, having this conversation, I fully appreciate that 99.99% of people will never have this opportunity, especially that early on in their career. And so it's my goal in this work to help facilitate these aha moments for other people, folks like yourself, and to share those moments with people. And so I want you to see yourself as active in this work, as if you have an aha moment, whether it's the first question I ask you or something else I share later on, that you don't keep that to yourself, but you think about how that might impact your work, how that might impact interactions in your personal life, how to apply that, and then how to share that experience with other people. So a little bit of background and context as to why this I find this work so meaningful and important, and why I'm thrilled that I get to work with the National Center to Reframe Aging. And just briefly, the National Center is housed at the Gerontological Society of America, and our work is really dedicated to ending ageism by advancing a more equitable, complete, accurate story about aging in America. We do this work by sharing proven research-based communication strategies with folks like yourself, and are really leading this movement, cultivating this movement to reframe aging, bringing together communities of individuals, coalitions, organizations, to not only spread awareness of the unproductive thoughts that we have about older people, but what strategies, what communication strategies can help us influence and build support for policies and programs that benefit us all as we age. We do this work in collaboration with many partners, TIFA being one of them. But the 10 organizations at the top left of your screen represent the 10 national aging organizations that came together over a decade ago and said, we all have this shared barrier of ageism. We come from different vantage points in the field, but ageism is really preventing our work from moving forward. And we think that of changing the culture around how people think about aging will benefit all of us and all of our work. So these 10 national organizations continue to support the National Center, the National Center's work. And then we also receive funding support from the four philanthropies listed on the screen and continue to work with our research partner, the Frameworks Institute. So as we think about where this work falls, and especially, and I love that I'm with an age-friendly audience, I want to put this graphic in front of you. Megan and Karan, you know this graphic well. It represents all of the different and growing sectors engaged in this movement to build an age-friendly ecosystem. And you can see public health represented there at the top, one of the early adopters of this mindset. What I love about this graphic, in addition to the public health part being there, is where communications falls at this. So as we think about building an age-friendly ecosystem, as we think about building an age-friendly public health system, part of that is thinking about the practices, the policies of our work, but also how it's communicated. And that communications part is the role of the National Center to Reframe Aging. So we'll go through a little, give you some high-level strategies here in a moment. But I also want, and I'm a visual person, so forgive the graphic, but really what this bubble graph is here is to serve as an invitation to think about those pockets of influence that you have. Yes, both in your professional work, which is why I know that you're likely here in this webinar, but also thinking about the personal pockets of influence that you have in your community and maybe a faith setting, and maybe you're a city commissioner or sit on some sort of board. This work infiltrates everything that we do. And finding different ways to share this with other people are the ripple effects that really lead to meaningful, lasting, and impactful change. And as we think about this, it's helpful to understand what gets in our way. And we would say that is ageism. As I shared, it was identified as our those 10 national aging organizations' shared barrier to advancing work. And just to level set, I'm going to share with you the definition that we use when thinking about ageism. And we borrow this from the World Health Organization's definition, which looks at how our negative beliefs about aging show up in several forms and how we think, how we feel, how we act, all directed towards people on the basis of their age. And then the definition goes to the next step, which is thinking about how those beliefs show up on multiple levels. So here we're looking at how does this show up in interpersonal interactions? It might be comments like, "Oh, Karan, you look great for your age." That qualifier of for your age being added there. We see this show up in compassionate ways where we're meaning well, but we sometimes refer to this as elder speak. It's that high-pitched baby language that we use with older people, oftentimes in healthcare settings, but we see it across community settings. That's the, "Oh, honey," the, "Oh, sweetie," "Oh, you're so cute," "Oh, why don't we do this? Let's get up, let's eat." That type of infantilizing language that we use with older people. And then we see how all of this has an impact on the institutions that we're a part of. So thinking about the laws, the rules, the social norms, the policies, both informal and formal, the practices of the institutions that we are a part of, that unfairly restrict opportunities simply because of someone's age. A great example of this are forced retirement ages. This idea that you're no longer able to work simply because you have turned a specific age. Ironically enough, the World Health Organization, from whom we borrow this definition, has a forced retirement age. So, this idea that once you're 67, you just are no longer able to contribute to the workplace. Um, Thank you, Caroline, for sharing in the chat. I love that response. It's a great inspiration of a way to respond in a healthcare setting. So, thank you for sharing. The last way that these ageist beliefs show up is how it impacts our own self-directed ageism. These are kind of the internal dialogue that we have with ourselves that says we're too young to be able to do something, or maybe we're too old to pull that off anymore. I can't wear that item, or I can't do that thing because I'm too old, right? So how we think about our own and envision our own aging. And understanding that is really important because there's real effects on our economy and our health. So in 2018, there was a first of its kind study that was done where researchers set out to identify what the economic cost of ageism, what that economic cost of ageism was on our health. And what the study ultimately found is that a reduction in ageism would not only have a monetary benefit for our society, but also have a health benefit for older people. So this specific study found that the 1 year cost of ageism was $63 billion, and that's billion with a B, or one of every $7 spent on the eight health conditions. So Megan and I were talking about grant funding as we were getting started with this call. Just imagine again, like all the possibilities of what you can do with 1% or even 0.5% of something like that. It's incredible to think about. And the study also that after adjusting for things like age and sex, also found that ageism resulted in 17.04 million cases of those eight health conditions. So again, the prevalence of this isn't just a passive thing that's happening in our communities, but there's real economic and health impacts of the prevalence of ageism. But I don't want to bog down with a bunch of negative news and data. I also want to share a study from Dr. Becca Levy and other researchers at Yale University that found that simply how we think about aging, our self-perception of aging, has the ability to impact our lifespan by an average of 7.5 years. So if we can cultivate, if there's maybe this is your aha moment of the presentation, but if we can cultivate in ourselves and in our community a positive relationship with getting older, that is one of the most profound things we can do for our longevity. Is thinking about and improving our own self-perception of aging. And I share all of these things and share the definition of ageism and give examples of that because of something that we found in our research, which you all, this is likely not surprising to you, but awareness is key. If we are more aware of how we think about aging, how ageism and implicit bias shows up in our work and in our life, then we are less likely to act on those beliefs. And it kind of brings something that resides under the surface up to the surface, and helps us kind of navigate around it. So all of this informs why we think it's really important to reframe and improve how the public thinks and talks about aging. And the steps of doing this are seemingly simple. So our first step was working with the Frameworks Institute, our research partner, to map the terrain. Our goal here was to understand how do experts in the field of aging want people to think about core questions, think about aging. What is that productive default response we want people to have? And how does that differ from where the public currently is? So we want to understand the terrain that we're navigating. And then from there, we're able to develop, and again with the Frameworks Institute, develop communication strategies that were shown to meaningfully move the needle and how people thought about the issues and solutions we were presenting them. And then this is where we are now. This is the goal of the National Center is to build that caravan. So this is step number 3. Help equip other people, help equip leaders in fields like public health with those strategies so that you can start applying and using them and infusing them in your work. A little bit of insight into what we found in that mapping the terrain stage of this work is here. So this gives us, helps answer the question of why aging? Why do we need to reframe this topic in particular? And this graphic shows you some of those core thematic questions, what we want people, some questions that we ask about aging. The blue boxes to the left show us where aging experts, that default productive response that we want people to have. And the boxes of the gray show kind of where the larger public audience currently is. And it's always helpful for me to remind myself that even if I do this work day in, day out, I am a member of the public too. So we oscillate and we exist on the spectrum in between these two boxes. I won't go through each one, but I think there's a couple that are really important for our work, and one in particular that I'll highlight that I think resonates for public health audiences. Um, So when we want to talk about what can be done to ensure well-being in older age, and we want to teach people what those effective interventions are. We want to talk about how we can improve people's social determinants of health and how early interventions impact us throughout our life. Right? We want to be able to communicate that there is so much that we can be doing. There is plenty that we can be doing to ensure well-being throughout our lives. So for us, it's much easier given the work that we do of where we want people to be with us is there's plenty we can do. If you would give me an hour, I could riddle you with all sorts of different interventions that would help. But what we see from a public response when asking these type of questions, and you all might experience this in your work, is kind of a shrug of the shoulders. It's the best visual that I have for it. It's this idea that's like, kind of is what it is. You're dealt the cards you're dealt. Um, that ball is rolling and it's too fast, and we're not going to be able to keep up with it. Right? The response that we get is there's nothing much we can do. It's very fatalistic. It's very defeatist. It's kind of like it is what it is. Right? This is the idea that things are happening around me and I don't have much control around that. So our goal in the reframing work is to help bridge this gap, bring more people to that blue box, bring more people to that productive understanding um, where we want them to be and exist. And to do that, I want us first to acknowledge that we are all communicators. Whether it is part of your job title, whether it is part of your job description, you are all communicating all of the time. And especially in public health, I imagine you all appreciate this point even more. Um, and in all of our forms of communication, and email, and presentation, and conversation, in meetings, whatever it might be, we are making choices. And we often make these choices unthinkingly. They're just kind of part of our unconscious way of communicating. We're choosing what to emphasize, we're choosing how to explain it, and we're choosing what we might leave unsaid. And when we think about making these choices in a reframing context, it's about choosing them strategically because we mapped the terrain, we're able to understand what's really important for us to emphasize because most people don't know what we know. What's really critical for us to explain, because most people don't have the privilege to do this work day in and day out. So they don't have the same access to knowledge that I do. So I need to emphasize and explain something a little bit more. And what's maybe something I don't need to say, because I can pretty well guess that it's already there. I don't need to highlight or underscore that for someone. I can leave it unsaid because my goal, again, is to help produce that more productive thinking about aging. So when we think about our theory of change with this work, and we're starting to see the impacts of this on all levels, our goal is that by adopting these strategies, and it's important to note that they are strategies. These aren't the magic words that will build the bridge and bridge the gap. But they're strategies that are malleable and adaptable to our individual contexts and settings that people model that. They mirror those communications back to us. When I started in this work now 6 years ago, the phrase as we age was not as prevalent as it is now. We see it much more frequently, and that is people mirroring and modeling that language back to us. And that leads to changes in how people think, and ultimately what we're after is that improved policy and program support. Um, so, an example that I thought might resonate with this group is a little bit of a cheerleading to say we've done this type of narrative change work before, and public health has been key to some of these narrative shifts that we've seen. So, one example that's really easy for me to think about and I think is pretty remarkable because we've seen it in our lifetime, is how we've talked about smoking, where we used to talk about smoking much more as an individual vice and had education to try to teach people about the harms to their health and what they need to be doing about uh, mitigating the risks to their own health and all of these kind of interventions that was very focused on the individual. And then all sorts of things happened, but we understood more about the impacts of secondhand smoke. And we started communicating then differently about the harms of smoking to community health, that this wasn't just about the person who was smoking, but that that individual action had impacts for our community. And that led to meaningful policy change. Right? When I was a kid, I remember going into restaurants and having to ask for a non-smoking section. My 5-year-old niece will not ever know that reality. She does not go into a restaurant and have to ask that. So we've seen this kind of there were all sorts of contextual things that were happening that influenced this, but part of it was how we were talking about this and moving from an individual vice to that of a concern for community health. And we saw, again, policy change. So this is the interactive part that I'm curious. I'd love to know from you all, in your experience, can you think of other examples from public health? It can be external to public health as well, of this type of positive frame shift that's led to a policy, some policy change or program change. And feel free to participate in the chat, or I'll pay attention to see if someone comes off mute as well.
Looks like we have a quiet audience today.
I was told by a mentor, silence is the sound of people thinking, but when we're all on Zoom, it's harder to know. I can tee you up with an example. Seat belts to me is another one that falls into this. There's Laura. Okay, safety issue of the time it takes to cross the road at stoplights. Time has increased. Caleb drinking and driving. That's another good one. Positive norms, reframing substance use efforts to develop new campaigns to reach youth effectively by using positive statistics norms. Allison, thanks for sharing. Yeah, you think about the advances we've made in talking about mental health. Right? This isn't to say that all of these things are solved. Obviously, these are still things we need to talk about. But think about how those are conversations that we have significantly and meaningfully changed how we're having those types of conversations. Kina thinks advances in brain health, shifting from dementia and Alzheimer's only language, back to sleep program for newborns to sleep on their back to prevent SIDS, removal of non-essential items in cribs. Yeah, these are, I mean, keep it going, keep participating in the chat. But it's suffice it to say this is changing culture is a big task ahead of us, but it's possible. And these are the examples that you share and other examples that might come to mind later didn't happen overnight, which is why we call this presentation a generation's work. We know that this type of cultural change takes time and takes about a generation to really steep in and influence all of the different institutions and policies and programs that we interact with. So this is what we're working to change and what is kind of the basis of our work. the fancy name that researchers give cultural models, which I just like to think that of these as kind of the culturally dominant assumptions that we all have to help us make sense of the world. We're taking in lots of different information every single day. We need these types of patterns of thinking, these cultural models, to help us filter all of that and make sense of it in a quick second. And all of our cultural models that we all have and rely on are developed over our life. They're influenced by where we grew up, how we grew up. They're influenced by the work that we do. All of that informs and shapes the cultural models that we have kind of existing in the ecosystem of our brain, and are using and relying on every single moment to make sense of, complex issues. Um, and in the absence of expert knowledge about an issue, what's really important about cultural models is that the public leans on these to kind of fill in the blanks and help connect the dots with something that's familiar. So our goal in our research was to understand what are the cultural models that people have about aging, and what of these cultural models are traps that ultimately kind of get in the way of that productive understanding that we want people to have? And what of these cultural models are helpful to us, even if they exist under the surface and are a little bit more kind of residual? What can we do to bring those uh, cultural models that are helpful to us, that help with that productive thinking to the surface? And those are the patterns of thinking, the cultural models that we want to advance. So we break these, kind of identified those different ones, broke them up into these different themes, placed them into these two buckets. We only have 20 minutes left, so I'm not going to go in depth into each one of these. But I am going to pause for a moment and share a video that more succinctly, gives some insights into one of the patterns that we want to avoid and something that we can do to help kind of navigate around that trap. Megan, I'll look for you for a thumbs up that you can hear this.
What do all these people have in common? Every day, they're doing something that we're all doing too. Getting older. Aging is a universal, shared experience. But the way we talk about it can diminish and harm older people, even when we don't mean to. It's phrases that casually equate being older with being less valuable. It's imagery that too often portrays older people as needy or isolated. There's a better way to communicate about aging. We can stop othering older people by talking about us instead of them. A them statement segregates and blames. For example, older adults are a challenge for our healthcare system. They make a lot of demands on a system that is not prepared to care for them. An us statement is inclusive and helps all of us see ourselves in the issue and in the solution. For example, we need a healthcare system that is built to help all of us live well as we age. When choosing photos, images of diverse older people interacting with others send a more inclusive message. When we shift from them to us, we promote a more realistic, inclusive view of aging, reduce bias, and build support for policies and programs that can help all of us at every age. The reframing.
So that gives you a brief insight into one of the primary strategies that we talk about. And I'll share with you that us versus them one is where I got started in this work. I think it's one of the traps that was easiest for me to understand, that we have this pattern of speaking about aging and older people that kind of puts older people in a separate group that we're not a part of. And the more kind of generous use of we that we can use in our work is incredibly profound. This idea that we are all aging is something that we repeat frequently, often over and over and over again. And we start to chip away at that idea that aging is something that other people do. It's not something that I do. So this is a summary of the other strategies that I want to spend the rest of our time speaking about. And the first one is talking about the process of aging as building momentum. So the idea that we're communicating with this strategy is that as we age, we gain new insight, new wisdom, new experiences, and we can use all of that to contribute to our communities. And our communities need to see that as an untapped resource. Uh, and you can hopefully feel a different energy with this type of communication, with this way of speaking about aging. It helps us counteract what people see when thinking about aging as kind of this inevitable process of deterioration, decline, loss of control. And we know that that deterioration, decline narrative is prominent in people's thinking about getting older. And so this type of strategy helps us counterbalance that, helps us kind of fill in the picture a little bit more. And when we use it well, it not only inspires that different story about aging, but it helps reduce ageist beliefs. It helps steer people away from that othering that we see so frequently with aging. Now, if you've been in a presentation with us before, you have likely seen this example. It is one of our favorites because it is so powerful in such a short amount of words. But we have colleagues in Boston that years ago were working on rebranding their commission on aging. It was like the Commission of Senior and Elderly Affairs, something like that. And part of that process, they asked older Bostonians what adjectives they wanted used to describe them. And strong and experience rose to the surface. So the commission is now called the Age Strong Commission, and part of a larger rebranding effort, they rebranded and rewrapped their senior shuttle. So on the left is a picture of a bus that says senior shuttle. On the right is a picture of that same bus, and in the small blue print, it reads transporting Boston's most experienced people. So you can see how this might impact not only the people utilizing this, but the folks that are seeing this bus pass by, and how prompting them with Boston's most experienced people might tap into a different cultural model that helps them have a slightly more positive view of their community members utilizing this service. Another example of this from colleagues at the Rush Center for Excellence in Aging shared with us is some of the work that they're doing on their website, sharing resources on how to, the how-tos, how to care for, in this case, older skin. And they did a reframe of it to really help prompt kind of move away from that anti-aging message and see this as an opportunity to communicate and highlight the importance of taking care of your skin throughout your whole life. We know that caring for your skin doesn't start at 65. Sunscreen is important throughout your entire life. So seeing even these short instances as an opportunity to help prompt that thinking for folks. The next strategy that we want to advance is to explain the supports we need to live meaningful lives as we age. And this idea that we all rely on a web of services and supports throughout our entire lives. This is not one I need to go into terrible depth with because I think public health folks understand and appreciate this so well, right? As we think about social determinants of health and how that impacts our ability to age well with a high quality of life. But even though the word social determinants of health to us says a lot, but if we think about someone who doesn't have a public health background or community health background, they might define that wildly differently than we would. So really thinking about how we paint a picture of this web of services. Um, Continuing on with the senior shuttle example, I think of how when I was a child, I used a school bus to get to my public high school, and that allowed my parents to get to work on time. And now, as an adult in a metropolitan area, I rely on public transportation to get me to and from work. And yes, one day I might rely on a senior shuttle to get me to a grocery store, a doctor's appointment, or a community event. So really painting the picture for folks and demystifying this idea of independence, because independence is really all of us being dependent on different types of resources, and that just ebbs and flows throughout our life. So again, some of the impacts that we see here, and one of our favorite examples for this is thinking about the curb cut effect. So this infrastructure that was originally inspired by someone who used a wheelchair, later required by the Americans with Disability Act, and now should be at most intersections in our community. But thinking about how this, yes, benefited the person using the wheelchair, but when we plan for someone at the center, it has ripple effects far and wide beyond that. Um, Thinking about the person delivering packages or the family pushing a stroller, or I'll pick on my 5-year-old niece again, my 5-year-old niece riding her bike. A curb cut helps us all navigate our community with better ease and safety. And then the last strategy that I want to talk about is the most powerful anecdote that we have to that shrug of the shoulders response that we talked about earlier. And that's this idea that we want to prompt the can-do attitude. We want to be cheerleaders for people. The world is overwhelming. There's lots of different issues to pay attention to. And we want to help make sure that people understand that we are problem solvers. We have faced big challenges before, and we've found a way to chip away at it. We've found a way to make an impact. And so, in all of our messages, especially knowing that people carry a strong fatalistic sense with them about what can be done about big issues, it is our responsibility to make sure and really draw a through line to effective, realistic, credible solutions that they can imagine, wrap their head around, and see why it's important and how they can be involved in it. So again, this is effective in kind of steering away from that fatalistic thinking, cueing that collective sense of responsibility and benefit. So as we end, I want to share a more lengthy narrative example with you all of what these strategies look like in practice. So I'll read bits of this message and then I'll show you a reframe of it. Make my screen a little bit bigger so I can read it. All right. So the message starts by saying, thanks to advances in disease prevention, public health interventions, and medical care, more Americans are living longer than ever before. And then the next paragraph starts, by 2030, nearly 1 in 5 Americans will be over 65 with many experiencing multiple chronic conditions, age-related cognitive changes, and complex medical and social determinants of health. Our current public health systems, healthcare facilities, and community-based services are already operating beyond capacity and lack the infrastructure to adequately serve this growing population. And then it ends by talking about without coordinated action across sectors, what the kind of devastating impacts of this will be. So a fair statement, right? This is accurate. There's lots of threats to public health. We experienced some of those this week even. So this is, I think, kind of a generalized example, but fair. What could we do to improve it? So this is just one example of maybe some framing decisions we might make differently. So we can start out the same way. Thanks to decades of scientific and public health advancements, many of us are living longer, healthier lives. This presents an opportunity to strengthen our public health infrastructure. So highlighting the opportunity leans into that can-do attitude that we talked about. And then we still use the by 2030 statistic, but we add in nearly 1 in 5 of us will be over 65. So helping people think about themselves as part of this. Again, infusing this is offering a powerful opportunity to reimagine our public health systems to better serve people across all life stages, and underscores and so it goes on. But you can see kind of the difference in focus of our language in this example, really highlighting the we, the us, the importance of investing in the structure, uh, in this public health infrastructure, and how that supports healthier aging for all of us throughout our lives. So just one example of what this might look like. The idea I want to leave you with before I share some resources with you and we get to some questions and I get to catch up with what the wisdom you all are sharing in the chat is I want to invite you to think about 10 years from now, uh, the headline that you want to see about public health and aging. So, as you think about the age-friendly public health systems work, what is 10 years from now, if we're successful in all of that, and the um, public health gets on board, they've adopted these strategies, they've infused age friendly within what they're doing. What's the headline that would result from that work? And as you think about that, I go back to the graphic that we started with to invite you to consider what communication strategies are needed to help achieve that. Communication alone isn't going to change it. That's why Megan and Karan are doing the work that they're doing. But if we kind of foresee what we want to have happen, the change that we want to effectuate, it's easier for us to also think about what understanding do we need to cultivate in order to achieve that, and what communication strategies will help us do that. So the National Center has a variety of resources for you. If you're just getting started, I commend the Quick Start Guide to your attention. It gives you a quick try this instead of this. We also have an online learning center that has a variety of tools on it, a bi-monthly newsletter, and that frame of mind video that I shared is one of many, and you can use it in presentations or use it to share with a colleague what you learned here today. One resource on our Learning Center I wanted to call out that I thought would be particularly interesting to this group is a webinar that we did last year, at the end of last year, to share some strategies for how to frame stories of lived expertise, so that we know that centering people with lived experience to inform the the programs and policies that we are creating is critically important. How we frame that is going to help us either kind of inspire sympathy or inspire action. So this is a webinar to help you adapt some strategies to inspire action. And with that, I'll encourage you all to set up a reminder for yourself a month from now with a subject line of what have I done to reframe aging this month. I'll leave this up there for you, and Megan, see if there's any specific questions in the chat I can answer in the last few minutes that we have here.
Thank you, Hannah, so much. As I mentioned, I think I always learn something new from you and from Trish whenever you present, and that you never fail to deliver. So Really appreciate all the wonderful resources and the availability of the videos and things that folks can actually use in their own organizations to begin to have this type of conversation, which I think is important for those of us working in public health to have those open lines of communication with our colleagues with whom we work, and particularly our communications teams. So I highly commend that you all take advantage of the resources that are available and share them with your communications teams so that as they develop communications around healthy aging, that you have access to all these wonderful ideas. So yeah, no questions that came up, but I will stop and see if anyone has a question, would like to come off mute and ask their question.
Well, I'll give space for questions too, but I want to shout out Cheryl. Thank you for sharing your headline in the chat. I love that that wasn't just a rhetorical question. So Cheryl's headline is Aging, Beautiful and a Gift. Look forward to it, which is awesome. So thank you for sharing that headline. And keep writing and imagining them.
I will also share that that we have had folks from the National Center to the TFAH office to present on ageism to our team. It wasn't nearly long enough. We could have spent many hours doing this type of training, but you all have helped us to actually do a review of some of our work, our publications, and have provided some amazing reframing ideas for our publications. So we have taken that to heart and really appreciate all the work that you all continue to do. Hannah, is there anything coming down the pike of your work that you'd like to share that we should be aware of?
Yes, so thank you for that opportunity. There's a couple of things that I'd highlight. The first is if you are interested, we're partnering with the Maine Council on Aging and their leadership exchange on ageism to host a first ever national healthcare cohort for that program. So be happy to share more details on that. It's in our latest Caravan newsletter, which you can see on our website. So that would be one resource. And then be on the lookout in February. We're going to be hosting a two-part webinar series to help equip people for the various advocacy settings you might find yourself in this year, whether that's preparing to go to the Hill with kind of a Capitol Hill Day or talking with a local legislator at a county or maybe a city commissioner or state legislator. So we're preparing that two-part webinar series to give you some specific strategies to help you in that advocacy context.
I think that is going to be so helpful. I'm very excited about that, and I'm going to share that with our GR team when that becomes available. So thank you for that.
Awesome.
Hannah, thanks so much. I'm going to stop here and turn back over to Karan, who will close us out. And I see one more headline: Aging well is the new normal. I love that.
Thank you again, Hannah. I do want to hear this more about your time living. I don't think I knew that story. We're going to have to get that story and swap stories of what brought you to this current phase in your career. But I want to hear that early story. I too have. I wasn't in a retirement. Well, I was in a retirement community, but I spent the night only temporarily, and I was there overnight. It was the funnest thing I've ever done, and it was in between college. Again, thank you everyone for joining us this afternoon. Just as a reminder, our next training will be in February, on February 19th to be precise. And that opportunity to register for that training is up and available on our website. So you can go under events under afphs.org to register. And if you are pursuing the AFPHS champion designation, please indicate your attendance at this training by navigating to the URL on the screen or using the QR code on the right to indicate that you have viewed this training. And this is for people that are here now in the live session and people that are viewing this as a recording. And with that, thank you everyone for attending today.
Thanks, everyone.